Magandang araw po muli. Ang ating pong topic ay pagpapatuloy sa pag-aaral ng sweat or blood. Number 10 na po tayo. So, activities that relax and calm. Ito po, dapat ginagawa natin. Meditation. Yun, nananahimik tayo sa isang lugar. Tapos yung mga gentle yoga. Kundalini. Ito po yung restorative or yin. Tai Chi. Yung mga movements po itong mga dahan-dahan lang pero ginagather yung energy natin. Pinapalakas. Or yung Qigong. Yan, ako ginagawa ko yung Qigong. Cooking. Kaya lang pag nagluto tayo, baka naman kain tayo ng kain. Reading. Okay din po yan. Nakaka-relax. Walking. Whatever works for you. So, kailangan po natin may mga activities na nakaka-relax. Tapos yung ease your mind. So, if anxiety and depression are persisting, kailangan pong consider seeking out a competent counselor. So, hindi po pwede sa mga marites tayo mag-open kasi baka lalo tayong ma-stress. Tapos kailangan po may support group. Siyempre, yung family, mahalaga po yan. Or mayroon po tayong psychotherapist. So, express yourself din po. So, kung get your liberty moving, find healthy ways to express anger. So, learn to express what you need. Yan po, yung ginawa niya, naiinis siya, kaya may ball siyang salip ng manuntok, at least yung ball yung kanyang piniga-piga. Pero pwede rin po yung pagalit ka, manguha ka po ng, ng ball pen, tapos papel or pencil. Yung yung left, right, left po yung ipang susulat mo. Lahat ng galit mo, lahat yun. Isang technique po rin para ma-release yung iyong anger. Hindi mo yun mababasa kaya hindi ka rin may hindi mo kayang basahin. Naka-release lang. Then work less. So look at your workload and do your best to make it a realistic one. So kailangan po may boundaries and limits for yourself. Work less and work smarter. Baka naman trabaho tayo ng trabaho, sobrang pagod na, yung trabaho natin hindi na magandang resulta. So kailangan po pag nagtatrabaho tayo, yung kaya lang ng energy natin, kaya lang ng utak natin, kaya ng power. Kasi kung overload po, madideplete yung chi natin, madidepress pa tayo. Kasi hindi na magandang resulta. Use fewer drugs or less alcohol. So do your best to sleep well. Kailangan po ng set a bedtime for yourself. Pag sinabi mong 8 o'clock, tulog ka na, dapat natutulog ka na, hindi ka na nagsa-cellphone. Make bedtime a ritual. Use your bed for sleeping, not working. Huwag ka magdala ng mga paperwork sa higaan mo. Kasi tiyak di ka matutulog, magtatrabaho ka pa rin. So kahit daw yung mga reading or studying, huwag kang magdala dun sa higaan mo. Wake up regular times. So kung gigising ka ng 5 o'clock, regular na 5 o'clock ka gumising. Okay. At dito po yung mahalaga. Kailangan tayong may regular acupuncture appointments. So with acupuncture, we use points to tonify spleen function so that we are getting the most out of our food in order to build blood. So kahit po wala tayong nararamdaman, pwede tayong magpa-acupuncture. So mas lalakas po yung energy, lalo pa yung spleen para maging blood. We also use points to improve quality of sleep so that our body is better able to store blood. So we work to calm the whole system down so that it can function more harmoniously. Kumbaga pag na malakas yung lahat ng organ mo, mas maganda yung trabaho. Yung output ng ginagawa. Ito po, pwedeng magpa-shiatsu. Shiatsu is good for blood deficiency because it is comforting and relaxing. And shiatsu massage, sarap niyan. So ito naman po yung mga habits which support digestion. Magluto po tayo ng mga foods na easy to digest and cook. Lalo pa dun sa mga may edad na mahina na yung panunaw. Dapat yung mga easy to digest na po yung ating piniprepare. No raw foods or salads. No cold foods. Kasi alam naman natin na pag pinapasukan natin ng cold yung spleen stomach natin, yung transforming function niya, transporting, pwede pong hindi niya magawa dahil mag-stagnant siya. Dahil sa cold. This means not just ice cream, but salads, chilled foods, drinks straight from the fridge, and excess fruits in winter. Ay ngayon, mainit. Yung iba, diretsong umiinom ng sobrang malalamig, then mamaya masakit ng tiyan. Kasi po, yung energy nung spleen natin ay naapektuhan ng cold. So, regular meals, regular phase of daily life, regular sleep, regular rest and relaxation. Napakalaga po nun, ano? Kaya may Sunday tayo, panahon para mag-rest and relax, manalangin, mag-yoga. Kailangan po yun, hindi Sunday na nagtatrabaho pa rin. Enroll friends and family in supporting your regularizing your habits. So kailangan may kasama kayo para mas ginaganahan. So pwedeng akitin mo yung kapitbahay mo na pareho kayong nag-yoga. Actually ginawa ko to. Habang nag-yoga ako, nagsisigong, nakikita ko nung kapitbahay ko. Sabi ko, hindi kasamahan mo ako yun. Ginagawa na rin niya. Then soup made with chicken stock. Yan. Kulo tayo ng mga buto-buto. Habits which support digestion. So, add warming spices to foods. Tulad po ng cardamom, nutmeg, ginger, and cinnamon. So, okay din po yung mga orange and yellow root and ground vegetable. Example, yung carrots po, yung pumpkin, parsnip, turnips, squashes. Pumpkins are sources of natural sweetness, especially when chewed well. They provide best nourishment for spleen and help reduce sugar and sugar cravings. Ako po may isi-share akong napakaganda po dun sa magpadagdag ng weight sa mga mapapayat. Pero kahit sa matataba po, hindi katataba. Yung yung kalabasa, sa morning ilalaga mo lang siya, then kuha ka ng fresh pong leaves ng malunggay, then dudurugin mo po yung malunggay, babayuhin mo, then imimix mo dun sa nilagang kalabasa, konting asin po, tapos sibuyas. Napakasarap po ng lasa. So very healthy food po siya at napakaganda sa spleen stomach. Anong pinagamit ko po yan sa pasyente kasi payat yung pasyente. After po 1 week, nag-gain siya ng 2 kilos. Doon naman sa mataba, nawala yung bilbil. Yun po yung effect ng food na yon. Regular pong pagkain sa morning. Food to avoid po. Ito yung sobrang milk, excess milk and cheese. Tsaka yung mga refined sugars. Yung mga chemicals in food. Iwasan po natin bumili lagi ng mga mapampalasa na puro chemicals. Liquids with meals. Yung mga junk foods, yun, marami po ngayon, mga chichirya. Ito, bananas and peanut. So, wag pong sobrang kumain din yan. Pero actually, dun sa ibang may problema na avoid po yung foods na yan. So, yung blood formation po, produced by the spleen, stomach, and kidney essence. Yun po yung napag-aralan, di ba? So, pag kumain tayo, magiging pudchi, then sa tulong ng kidney essence, and form in the heart. Dadalhin po yun sa heart para i-circulate yung magiging blood. Yung blood function naman po, ang function ng ating blood ay in-nourish yung ating body, moisten. Tapos yung blood also ay basis ng ating mental activity. Kasi nga kung kulang ka sa dugo, hindi ka masyadong nakakapag-isip. Kaya nga yun, yung minsan sabi natin na parang wala ka sa sarili. Blood circulation, ang nagsisirculate po niyan ay ang heart. Heart moves it. Then yung spleen nagpo-produce ng blood. Then si liver po ang nag-store. Kaya napakahalaga yung panahon na dapat natutulog tayo sa liver time. 1 to 3 a.m. tulog tayo para makapag-store ng blood si liver. Okay, so yun po yung ang mga ginagawa ng blood sa atin.
Thank you very much.
Po, salamat.
Maraming salamat po. We now go to tongue diagnosis. And let's call on Ma'am Teresita Sumile. Good afternoon po, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Welcome po sa tongue diagnosis. And now let's talk about pale tongues with a depression at their root. Continuation po ito sa lesson natin kahapon. Okay? Essence is responsible for the conservation and quality of substance, and a deficiency of essence implies loss of this substance as reflected in brittle bones or loss of teeth. Consider the following example. A young woman had been suffering for a long time from anorexia nervosa. Her symptoms included the cessation of periods as well as osteoporosis. The tendency to starve itself had caused the exhaustion of the postnatal essence, which in turn failed to replenish the kidney essence. The young woman's loss of substance manifested in brittle bones. The practitioner is first alerted to a deficiency of essence by the patient's history and corresponding symptoms, as well as through specific pulse qualities. In order to formulate an accurate diagnosis and prognosis, it is important to assess quality and strength of the essence. Alongside all the other collected data, the diagnosis of the tongue can contribute a great deal of information about the quality of the essence. Owing to its fluid nature and substantial qualities, essence is yin in nature relative to the dynamic power of qi and yang. It thus has a strong affinity to kidney yin. Because of this, kidney yin deficiency can lead to deficient essence, all processes in the body that lead to loss of fluids, severe and long-lasting diarrhea, extreme sweating, or long-lasting febrile disease will eventually injure the yin. The loss of fluids and yield will produce dry red tongues, as we can see in the tongue picture above, which can be an indication of severe indeficiency of kidney yin and of declining essence. In clinical practice, these tongues are most commonly found in severely ill, elderly patients, or in those who suffer from a progressive cancerous disease. However, such tongues do occur in young people who have been affected by a wasting disease like AIDS. A red tongue can reflect development of intense heat, which can injure the yin. The more intense the redness of the tongue body, the greater the heat, which has attacked the kidney yin and fluids. The interplay between kidney yin and kidney yang depends on the strength and quality of the essence and source qi. The essence through the kidney yang and the gate of vitality, which is Mingmen, supplies the material necessary for the transformation and forming actions needed to produce kidney qi. The tongue coating is highly dependent on these actions. If the fluids are not transformed, either because of kidney yin or kidney yang deficiency, then the kidney qi is unable to rise to moisten the tongue. In extreme cases, this becomes visible in a very pale, swollen tongue body that is dry. Here, but kidney yang is too weak to transform, thus making the tongue body into swollen and transport the fluids, making the tongue body into dry. This is rarely seen in the clinic. More commonly, a dry tongue appears as a result of deficient fluids, blood, and stomach or kidney yin. Lack of tongue coating is primarily associated with functions of stomach and spleen qi. The fermentation of solids and liquids by the stomach qi and the healthy damp climate of the stomach contribute to a turbid steam that ascends and becomes the foundation of the tongue coating. If the energies of the middle burner function without any problems, there will be an evenly distributed thin coating that is closely attached to the tongue's surface. Deficiency of stomach qi, stomach yin, and especially kidney yin can lead to a coating without a root. This coating is characterized by its uneven distribution, which gives it an old, peeled appearance and looks as if it could be easily scraped off. The lack of a tongue coating coupled with a pale tongue body indicates a lack of stomach qi. This combination, plus the appearance of superficial cracks in the center of the tongue, may signal the onset of a decline in fluids in stomach yin. Root of tongue corresponds to lower burner, especially the kidneys. In general, the tongue coating at the root reflects condition of large intestine, small intestine, and bladder. Complete interpretation of the coating at the root requires knowledge of the patient's symptoms. Absence of coating at tongue root or red root reflects deficiency of kidney yin and exhaustion of the body fluids. A very red and dry root signifies that kidney fire has arisen from deficiency of kidney yin. Texture and form of root of tongue also mirrors condition of the kidneys. A contracted root of a depression of the root represents a deficiency of essence. These tongue shapes are result of loss of substance or material. As a result, tongue lacks appropriate volume of shape. If tongue root is at a normal color, deficiency has not yet advanced to stage of internal heat. Incipient lack of essence may be associated with pale tongues. The incipient deficiency of essence manifests as pale tongue with a depression at its root. It is as if there were a lack of substance to fill the root of the tongue. This condition is characterized by combination of qi deficiency symptoms like fatigue, lack of appetite, sweating, upon the slightest exertion, loose stools, as well as symptoms indicating deficiency of essence. Thus, fatigue may evolve into exhaustion not alleviated by regular sleep. There may be lack of concentration, failure of memory, or head hair may turn prematurely gray. In such cases, it is not enough simply to tonify the qi. The essence as well as kidney yin and yang must also be nourished. Hectic lifestyle associated with modern industrialized countries can contribute to premature consumption of essence. The earlier this can be detected, especially in young people, the sooner prophylactic and supporting measures by both patient and practitioner can be undertaken. It is possible to evaluate conditions of essence and extent of which substance has been lost by examining tongue body shape, not just tongue body color and coating. Now let's go to our patient, female, 33 33 years old. Tongue description, slightly pale, swollen, slight protrusion at the tip of the tongue, and has slight depression of the root, as we can see in the tongue picture. Then patient presented symptoms of exhaustion, burning sensation after urination, severe cramping pains before and during menstruation. Western diagnosis, chronic cystitis, and dysmenorrhea. Background to disease, chronic overwork, excessive use of willpower, and 12 operations in childhood and puberty. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Next, we have diagnosis by interrogation. And let's call on Ma'am Vina Pascua, straight from Baguio. Good afternoon, Ma'am Vina.
Good afternoon po, Doctor. Good afternoon po sa lahat. So, continuation po ito kahapon, mental emotional symptoms, day 8 na po tayo at fear and anxiety, day 3 po. Diagnosis, excuse me. The panic attacks are caused by rebellious chi in the penetrating vessel. The clinical manifestations displayed by this patient are fairly typical of a penetrating vessel's pathology of chi revealing upwards along its pathway. The penetrating vessel flows up through the abdomen and chest along the line of the kidney channel and flowing through the heart on its way up to the throat and face. Therefore, it influences the heart and chest. Chest area, and in this case, is causing the symptoms of palpitations and breathlessness. The symptoms associated with the syndrome of chi revealing upwards in the penetrating vessel were called LIGL, which literally means internal urgency and indicate a state of anxiety and panic, as in this case. So dito nakikita natin yung rebellious chi of the penetrating vessel. Ang anxiety po is mental restlessness, internal urgency. So dito sa head and neck area, nakakaramdam po siya ng headache, feeling of heat sa kanyang mukha, feeling of lump in the throat. Dito naman sa breast area, slight breathlessness, sighing, palpitations, feeling of tightness of the chest, feeling of distension of the breast in women. So sa abdomen, fullness, distension, pain of the epigastrium. So my feeling of tightness then below the xiphoid process. Hypogastric fullness, distension, pain. Fullness, distension, pain of the umbilical area, fullness, distension of the lower abdomen, at painful periods, irregular periods. So sa kanyang paa, cold feet po. So the tension in the throat or difficulty in swallowing are caused by the chi of the penetrating vessel revealing upwards. The feeling of heat is caused by the chi of the penetrating vessel rushing up to the face. This is reflected sa overflowing quality ng pulso on the left front position and the weak quality of the left rear position. Ang kanyang pulso po ay nagre-reflect na maliwanag yung deficiency of the penetrating vessel sa kanyang lower abdomen and the subsequent rushing upwards of the rebellious chi to the face. It should be remembered that the pulse position ay nagre-reflect po ng not only the organs but also the areas of the body and their respective channels. In this case, there is emptiness below, so sa lower abdomen, and fullness above, sa throat and face, making the pulse weak in the third position and overflowing in the first. However, in this case, yung pulso po niya ay nagre-reflect din ng pathology of the relevant organs. The weak pulse on the left rear position indicates kidney deficiency, predominantly of kidney yin, as evidenced by yung peeling of the root of the tongue and the night sweating. The overflowing quality on the left front position indicates heart heat which is evidence naman po by the red tip ng kanyang dila. The swelling of the tongue indicates the presence na may phlegm, but she has no symptoms of this at present. Such cases highlight the preventive value of tongue diagnosis. At sabi ng author, I would therefore resolve phlegm even in the absence of symptoms. The fact that when describing her symptoms, the patient repeatedly and emphatically said that yung nulit-ulit niya yung sinabi niyang throat may indicate that the origin of her condition is an emotional one and that she had felt unable to express herself, leading to the feeling of restriction sa kanyang lalamunan, sa kanyang throat area. Yan po. So, yan lang po. Thank you very much. Thank you, Doctor.
Thank you very much, Ma'am Vina. Next, we go to pulse diagnosis. Let's call again on Ma'am Mildred to continue her discussion of the pulse qualities. Good afternoon, Ma'am Mildred.
Magandang araw po muli. Ang ating pong patuloy na pag-aaral sa pulso, pulse qualities number 3. So, the width of the pulse. Divergences in the width of the pulse result in the pulse being described as being either wide or thin. The width of the pulse can be determined by slowly rolling the fingertips. So, medyo papagulungin po natin doon sa pulsuhan. Then, laterally, back and forth. So, medyo pabalik-balikin po natin para maramdaman natin yung width around the arteries dun sa pulsuhan. A wide pulse feels broader than a thin pulse. So, mas pag kinapa po natin, mas malawak yung naaabot ng pagpintig. Yun po yung wide pulse. The pulse's width is independent of its strength and depth. The length of the pulse. The pulse's length is determined by rolling the tips of the fingers artery. So, yung parang pinababalik-balik natin. The length of the pulse is defined by how far up the arms the pulse is felt. In the case of a short pulse, how little it fills out the 3 pulse positions. So, pag long pulse naman po, can be felt further up the arms towards the elbow. So, beyond the chi position. Yung chi position po yung sa kidney part, sa dulo. So, pag long pulse po, ito po yan sign ng heat or rebellious liver chi. Or mayroon po siyang liver stagnation or ascending liver yang. So, if the pulse is normal in its rate and strength, yun po ay normal pulse. And it will not be given any diagnostic significance. Siyempre, normal siya eh. A short pulse po will not fill out all the 3 pulses position. So, pag short pulse po, yun, yung part lang na nilagyan mo ng kamay, dun mo lang siya mararamdaman. It is not as long as normal pulse, or it will feel as if the pulse cannot be felt fully in each of the individual pulse position. Short pulse. Pag nilagay mo yung kamay mo, halimbawa po dun sa right lung area, pag short pulse pang mararamdaman mo, dun lang yung sa lung area na yon. Pero minsan parang hindi mo siya maramdaman na buo dun sa fingertip mo. So, yun po yung short pulse. So, the pulse position themselves seem shorter than normal. The rhythm and regularity of the pulse. So, the pulse should be rhythmic in its beating. It should not skip any beats and the speed. Kaya talagang nakakonsentrate po tayo, pinapakiramdaman yan. Natuloy yung pagpintig. Strength and other qualities should remain constant whereas you feel it. So, dapat tuloy-tuloy yung pagpintik, yun yung normal. Some pulses are rhythmic in their beating, but irregular in terms of strength and speed. So other pulses skip beats. When a pulse skip beats, it is important to determine whether it is the same beat that is skip. Halimbawa po, karaniwan sa heart part po yan nag-skip pag may problema yung heart. Parang minsan di natin mararamdaman yung pintig. For example, every fifth beat or whether the breaks in the rhythm are random. The speed of the pulse has diagnostic significance in an irregular pulse. Yun. Kaya pinapakiramdaman po yung kung tuloy-tuloy yung pagbeat niya. So, diagnostic pulse images. The easiest way to learn the various pulse images is to learn them as a group. Ayan po, nakagroup siya. Yung 7 superficial pulses po, ito yung superficial, drum skin, hollow, empty, flooding, saggy, and scattered. Yung mga unang discussion po natin, na isa-isa na po natin yan, kung anong itsura niya mga pulses na yan. So yung 4D pulses naman po, ito yung deep, weak, hidden, and confined. Yung 3 irregular pulses po na nararamdaman yung knotted, putol-putol, intermittent, and skipping. Other pulses image po, ito yung long, short, wiry, tight, choppy, slippery, steering, rapid, very rapid, slow, full, large, fine, and faint. So, siya po yan yung iba-ibang image. Ang superficial pulse po, there are several types of pulse that are classified as being superficial. So, it is important to note which other qualities the pulse has to distinguish the different pulses from each other. So, marami pong pulso ay similar, magkakapareho. And their diagnostic significance is often also very similar. So, yung main differentiating factor among the superficial pulses is their strength, yung lakas. So, napaka-importante po, therefore, to ask yourself whether the pulse feels strong or deficient. Kasi nagsasabi to nung lakas nung pathogenic factor na pumupunta dun sa organ. So, a superficial pulse will be consequence of the presence of Qi or excess condition of Qi in the exterior. Or an exterior Shu condition or deficient. In an exterior deficient condition, the pulse will feel weaker. So, pag deficient, mahina po ang pulso. Or wala. Pag inyong pinrest sa deep level, diniinan mo na, halos napakahina or wala kang mararamdaman. So, yun po yung weak pulse or deficient pulse. When there is an invasion of exogenous sweat qi, si qi, ito po yung yung mga pathogenic factor na qi, si qi. The pulse will generally be powerful. But even more so the superficial level. Pag yung mga halimbawa po yung damp cold heat, wind, yung mga pathogenic factor po yan, yan, Zichi. Karaniwan po ang makakapa natin sa pulso, lalo na sa lungs, kasi minsan yun ang unang pinapasok. Very powerful po. So strong siya sa superficial level. So it is also important to note whether the pulse is rapid or slow. Kasi alam natin kung rapid or slow, alam natin kung yin deficient or yang deficient. In order to determine or there is heat or cold. Yan po yun The 7 superficial pulses are, ito po yung superficial, drum skin, hollow, empty, flooding, saggy, and scattered. So yun po yung ating different kind of pulses.
Thank you very much, Ma'am Mildred. I'm sure maraming natutunan ang ating attendees on the pulses. We still have a long, long way to go. Thank you. Next, we go to differential diagnosis. And let us now call on Ma'am Needs to discuss phlegm obstructing the lung. Good afternoon, Ma'am Needs.
Good afternoon, Doc Hector. Good afternoon, everyone. Welcome to our TCM Foundations number 192, Phlegm Dump Obstructing the Lungs. Okay, so let's begin with the causes, etiology, invasion of exterior cold, poorly expelled, overexertion and poor diet over long period, yeah, excessive consumption of greasy and cold raw foods, leading to phlegm dump production by spleen, settling in the lungs. So, yan, chronic spleen and lung yang deficiency. Yan po yung mga dahilan. Okay? Sign and symptoms naman, let's go to it. Cough with easy expectoration of watery white sputum. Okay, merong maririnig na parang putok. Aggravated by exposure to cold. Aggravated by physical movement kapag naglalakad or something, nagmo-move. Feeling of cold, lalamig. Cold hands, phlegm sa throat, dizziness, feeling of fullness and oppression in the chest, feeling of cold in the chest. Yan po, yung mga sign and symptoms. Let's go to the pulse. When you palpate, it is slippery and slow. Okay? When you see the tongue, it is swollen and it is wet with sticky white coating. Okay, remember. So treatment principle, transform phlegm dump, regulate waterways, descend lung qi, suppress cough. Yan. Then acupuncture treatment points, lung 5, clears phlegm from lungs. REN 17 or CV17 supplements lung qi. Bladder 13 sa back supplements lung qi. Okay? REN 22 sa harap, CV22 din yan dito sa may sa may throat, diffuses lung, transforms phlegm. Okay? Li4 releases the exterior. Pericardium 6 loosens the chest and rectifies qi. Lung 7 descends lung qi. REN 12 or CV12 resolves phlegm. Bladder 20 supplements spleen and resolves phlegm. Spleen 3 supports the spleen. Lung 9 supplements lung yin. And stomach 36 transform dump. Okay? Needle technique is with even method. Okay, thank you po everyone. I hope you learn.
Thank you very much,
you, Doc.
Needs. I'm sure they have learned a lot from the presentation. Okay, so from differential diagnosis, we proceed to acupuncture patterns and practice. We will continue discussing stroke. This was our topic yesterday. Key points of analysis and differential diagnosis. Stroke may be diagnosed if there are 2 or more of the following groups of findings. Principal symptoms, mental confusion, loss of consciousness or coma, hemiplegia with dry mouth and tongue, dysphagia or aphasia, or numbness in the affected parts. Number 2, abrupt onset, often associated with sudden changes in weather, excessive physical fatigue or exhaustion, or overstimulation by passions or other emotional stress. Number 3, preceding symptoms. Ito na yung aura of dizziness, headache, numbness, or weakness in the limbs. And number 4, if your age is above 40, you can also have you're a candidate. So let's now talk deficiency versus excess or strength. Stroke is a condition wherein the root is deficiency and the appearance is excess. The acute phase is mainly a condition of strong symptoms. In a patient with chronic dizziness and headache, sudden appearance of hemiplegia, especially if accompanied by loss of consciousness, tetany, or convulsion, the condition is due to stirring of endogenous wind. If the prominent symptoms are expectoration of much sputum, respiration with gurgling in the throat, disturbed mental state, and white and greasy tongue coating. This is due to large accumulation of turbid phlegm. If the prominent symptoms are dry mouth with bitter taste, restless agitation, scant dark urine, constipation, and feverishness in the neck and back, this is due to exogenous heat. If the limbs are flaccid and the tongue cyanotic, this is due to deficiency of yang qi and much stasis of blood. The convalescent phase is mainly a condition of deficiency. If paralysis of the limbs is accompanied by edema of hands and feet, may shortness of breath, spontaneous sweating, and copious salivation, the condition is mostly due to qi deficiency. If there is cold aversion and the limbs are cold, yang deficiency. If the prominent symptoms are restlessness with insomnia, dry mouth, hotness in the palms and soles, red tongue with scant coating, yin deficiency with internal heat. Meridian versus viscera. Stroke may be classified as that primarily involving the meridians and that primarily involving the viscera. In stroke involving the meridians only, hindi po affected ang mental state. Prominent symptoms, hemiplegia or numbness, stiff tongue with dysphagia or aphasia, wry mouth, and tongue. The pathogenic evil is shallow, condition is mild. In stroke involving the visceral organs, meron na pong mental confusion or loss of consciousness. Pathogenic evil is deeper and condition more serious. Stroke involving the visceral organs may further be classified as blockage type and the prostration type. Yung blockage type of stroke, there will be disturbances of the mental state, trismus, and spasticity of the limbs. It is due to pathogenic evil qi blocking the upper orifices, and this is a condition of excess. If there are facial flushing, body feverishness, coarse respiration, halitosis, restlessness, yellow and greasy tongue coating, and slippery and rapid pulse, the blockage is caused by phlegm heat. This is stroke due to yang blockage. If instead the additional symptoms are pallid lips and complexion, calm resting, copious saliva, and sputum, cold limbs, white and greasy tongue coating, and a deep and slippery or even pulse, the blockage is caused by dampness phlegm. This stroke is due to yin blockage. In contrast to the blockage type, the prostration type of stroke manifests coma, closed eyes, open mouth, flaccidity of all limbs with open and relaxed hands, cold limbs, incontinence of urine and feces, shallow and weak respiration. Prostration stroke is caused by escape to the outside of the genuine yang of the yang viscera. Progression from the meridian type to viscera type will reflect the waning of the genuine qi and the waxing of evil qi. It indicates worsening of the condition, poor ang prognosis. This progression can be recognized because now we have the development of coma, spasticity, and impairment of pupillary reaction to light. Conversely, progression from the visceral type to the meridian type with improvement in the mental state will indicate improvement and a better prognosis. Acupuncture treatment. For the meridian type stroke, yung medyo mild pa. For hemiplegia, we use filiform needles and apply reducing method on the affected side and the reinforcement method on the unaffected side. For upper limbs, we have GB21, LI11, LI10, SJ5, LI4. Lower limbs, gallbladder 30, gallbladder 34, stomach 36, stomach 41, bladder 60. Okay, pag dry mouth and tongue, use filiform needles and apply the even method. So you are neither reducing nor reinforcing. Select stomach 4, stomach 6, LI4, stomach 44, and liver 3. For visceral stroke, visceral type stroke, for the blockage stroke, we have to select the 12 Jingwell acupoints. Governing vessel 26, liver 3, stomach 40. Use filiform needles and apply the reducing method. The Jingwell acupoints are pricked with a 3-edged needle to cause bleeding. Now, sa prostration stroke, we select CV4 and CV8. Apply ignited moxa cones at the acupoints. Case study. Patient was a 65-year-old female, 10-year history of high blood pressure, frequent headaches. She was admitted because of sudden coma, right-sided hemiplegia, and aphasia for 3 days. No vomiting. On examination, comatose patient. Temperature was 38.5 degrees Celsius and blood pressure 150/90. She had trismus and dry lips, tongue flaccid, thin yellow greasy coating, pulse slippery, rapid, and forceful. Auscultation of the lung, meron pong medium and fine moist trails over the lower lobes. Percussion of the heart showed the cardiac border at the left mid-clavicular line in the 5th intercostal space. Heart rhythm, normal. Neurologic exam, stiff neck. On the right, the affected side, the muscle tone was reduced. DTRs were 1+, and the Babinski sign was positive. Lumbar puncture yielded blood in the CSF and the CSF pressure of 270 millimeters water. Diagnosis, stroke of the viscera type and yang blockage. Treatment principle, dissipate phlegm, unblock the viscera, cool heart heat, and open the orifices to resuscitate. Thank you very much. And now we go to the next. We'll discuss the BPH. Let's listen straight from Baguio. I know, di pa pala. Signs and symptoms, I'm sorry. Let's listen straight from Rizal, Ma'am Teresita Sumile. She will discuss the philtrum. Good afternoon, Ma'am Teresita.
Good afternoon po ulit, Dr. Hector and classmates. Now let's go to signs and symptoms. Number 84 na po tayo. And now let's talk about flat philtrum and stiff-looking philtrum. First, we will take up flat philtrum. In kidney deficiency, the patient has flat philtrum. She has also lower backache, dizziness, tinnitus, tiredness, and other symptoms and signs, including those of the pulse and tongue, depend on whether there is a kidney yang or kidney yin deficiency. In damp heat in the stomach and spleen, patient has flat philtrum and has a feeling of fullness and pain of the epigastrium and lower abdomen, poor appetite, a feeling of heaviness, thirst without a desire to drink, nausea, loose stools with offensive odor, a feeling of heat, dull yellow complexion, sticky taste, red tongue with sticky yellow coating, and has slippery, rapid pulse. According to the ancient Chinese art of face reading, a flat philtrum in women may indicate infertility. Now let's go to stiff-looking philtrum. In blood stasis, patient has stiff-looking philtrum, dark lips, abdominal pain, chest pain, headache, purple tongue, and the pulse is wiry or choppy. Pale philtrum. In Qi deficiency, patient has pale philtrum, tiredness, poor appetite, loose stools, weak voice, pale tongue, empty pulse. Other symptoms and signs again depend on the organ involved. Next is full cold. In full cold, patient has bright pale philtrum with grayish pale complexion, abdominal pain, epigastric pain, cold limbs, pain that is alleviated by exposure to heat and by drinking warm drinks, and that is, excuse me po, aggravated by exposure to cold and by drinking cold drinks. Thick white coating and the pulse is tight, and other symptoms and signs depend on the organ involved. In empty cold, patient has pale phlegm with grayish pale complexion, dull abdominal pain, dull epigastric pain, cold limbs, pain that is alleviated by exposure to heat and by drinking warm drinks, and that is aggravated by exposure to cold and by drinking cold drinks.
Naka-mute.
Ay. I'm sorry po. Saan ba ako? Saan ba ako nawala? So in empty cold ba, Doc?
Yeah.
In empty cold, patient has pale phlegm, grayish pale complexion, dull abdominal pain, dull epigastric pain, cold limbs, pain that is alleviated by exposure to heat and by drinking warm drinks, and that is aggravated by exposure to cold and by drinking cold drinks. Feeling cold, tiredness, pale tongue with thin white coating, and the pulse is deep weak. Then, other symptoms and signs depend on the organ involved. Yun lang po. Thank you so much for
Thank you very
listening.
much, Ma'am Teresita. Nasa medyata kayo. Okay. Thank you very much. Now let's go to the last, but not the least, topic, BPH. And let's now call on Ma'am Vina Pasqua, straight from Baguio. Good afternoon po, Ma'am Vina.
Good afternoon ulit po, Doctor. Good afternoon po sa lahat. So, benign prostatic hyperplasia po tayo. The prostate, day 2. Clinical note, it is legitimate to postulate that the prostate is a structure that is equivalent to the uterus in women, and that the governing vessel, directing vessel, and penetrating vessel flow through the prostate. There are indeed several connections and equivalences between the physiology of the uterus in Chinese medicine and that of the prostate. Firstly, as the governing and directing and penetrating vessel is all flow through the prostate. They are the vehicles through which the hypothalamus, pituitary gland, and prostate interact with each other in a complex feedback mechanism in the same way as the hypothalamus, pituitary gland, and ovaries do. Secondly, there are many correspondences between the physiology of the uterus at saka yung ovaries and those of the prostate from a Chinese perspective. Ito yung corresponding physiology of the uterus and ovaries and prostate. Excuse me. Uterus, ovaries, uterus muscular tissue, tsaka ito yung sa prostate. Controls the outflow of urine through the bladder and into the urethra. Prostate's fibromuscular tissue is approximately 30% of its total tissue mass. This role is closer to that of an organ than that of a gland. Ito naman, ovaries produce eggs. Sa prostate, the seminal vesicles produce their own seminal fluid, which nourishes and gives volume to the sperm. The prostate adds its own prostatic fluid to the mixture. Ovaries mature at puberty. Almost all the prostate mass develops during puberty in response to hormonal changes associated with maturation. The prostate literally doubles in size during puberty. Ito naman, ovaries peaks during adolescence. Testosterone is at its peak during adolescence. It decreases thereafter and more rapidly by approximately age 50. And then ito naman, change in balance of REN and DO-MY with menopause. During male menopause, an increased ratio of estrogen to testosterone, just as in women passing through menopause. The ratio of testosterone to estrogen increases po. The main organ that affect the prostate are certainly itong kidney at saka yung liver. In the same way that these two organs affect the uterus and ovaries. The prostate plays a role in making of sperm. So yun ang trabaho nila. The chan goo of men, and it is under the influence of the kidneys, which are the origin of the chan goo. The heart also influences the prostate in the same way as it influences the uterus. Heart chi and heart blood ay kailangan pong need to descend toward the kidneys to establish the communication between these two organs. In women, the communication between the heart and the kidneys forms the basis for a normal menstrual cycle and ovulation. Sa mga lalaki naman, the communication between these two organs ensures the smooth functioning of the prostate and the regulation of the feedback mechanism among the hypothalamus, pituitary gland, at saka yung prostate. So dito nakikita natin sa figure yung room of sperm. So dyan sa heart, sa kidneys, ito naman yung rinmay at saka dumay. Yan po. In terms of channels, the channels affecting the prostate are the kidneys, governing vessel, directing vessel, and penetrating vessel. The anatomy of the male genital system from the point of view of Chinese medicine, gaya na napakita kanina, there's a complex feedback mechanism among the hypothalamus, pituitary gland, flow of the governing vessel, which flows through the brain, and the directing vessel. From the point of view of Chinese medicine, the clinical manifestation of BPH closely resemble those of urinary retention. However, although BPH often causes urinary retention, not all cases of urinary retention are due to prostatic hyperplasia. So dito nakikita natin yung the male genital system from the Chinese medicine point of view. Yan yung dumay. So basahin na po natin. So duchong, ranging, dumay. So ito yung spine, rectum, vas deferens, duching, ranging. Ito naman yung bladder, pubic bone, prostate gland, urethra, penis, testicles, at saka scrotum, yung chungmay po. At saka itong isa naman sa do-rin-may. And then ito naman, tingnan na po natin, the hypothalamus pituitary prostate axis, gonadotrophin-releases hormone. Yan po. So the prostate in Chinese medicine, so prostate problems were not discussed in ancient Chinese medicine because yung prostate itself was not mentioned. So bowel is a structure common to men and women, in the former corresponding to the room of sperm or room of essence, and the latter to the uterus. So ito yung summary niya. It is therefore legitimate to assume that the prostate is a structure that is equivalent to the uterus in women and that of the governing vessel. Directing vessel and penetrating vessel flow through the prostate. There are several connections and equivalences between the physiology of the uterus in Chinese medicine and that of the prostate. And then the main organs that affect the prostate are the kidneys and the liver. And in similar way to how these two organs affect the uterus and ovaries. The next eye, the heart also influences the prostate in the same way that it influences the uterus. The channels affecting the prostate are the kidneys, tanda po natin, liver, governing vessel, dilating vessel, and penetrating vessel. The clinical manifestations of benign prostatic hyperplasia closely resemble those of urinary retention. So yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. So now we are ready to answer your questions. If you have questions, please write them down at the chat box. Okay, so again, we would like to thank all of the presenters, and we would like to thank also those who attended today's session on our continuing education for acupuncture. Okay, thank you very much, everyone. God bless. Good afternoon po.
Thank you so much, Doc. God bless you too.